I believed insurance would save us.
Instead, it buried us alive. When you pay for health insurance every month, you think you're protected. You think that if something terrible happens, an accident, an illness, a diagnosis, the system will catch you. That's what insurance is for, right?
To keep you from losing everything when life falls apart. I learned the hard way that American health insurance isn't designed to protect you. It's designed to profit from your suffering. And when my wife was diagnosed with cancer, I discovered that the fine print matters more than the promise. That coverage doesn't mean they'll actually cover you. That medical bankruptcy isn't something that happens to irresponsible people. It happens to people like me who did everything right and still lost everything. My name doesn't matter for this story.
What matters is that I am one of over 530,000 Americans who file for medical bankruptcy every year. We had good jobs, we had savings, we had insurance,
and we still ended up homeless, bankrupt, and broken by a healthcare system that treats patients like profit centers and families like acceptable collateral damage.
I grew up in the suburbs of Denver, Colorado.
Middle-class family.
2 parents who worked hard. My dad was a high school teacher. My MO managed a small accounting firm.
We lived in a neighborhood where kids rode bikes until dark and everyone knew each other's names. We weren't wealthy, but we were comfortable.
We had what we needed: a roof over our heads, food on the table, and the security of knowing our parents could handle whatever came our way.
I met Sarah in college at Colorado State University.
She was studying elementary education. I was majoring in marketing. We started dating junior year and got married 2 years after graduation, in 2006.
It was a small wedding family and close friends at a park in Fort Collins.
We honeymooned in Rocky Mountain National Park because that's what we could afford. We didn't care. We were 24 years old, in love, and optimistic about the future. I got a job at a mid-sized marketing firm, entry-level account coordinator.
The pay was $48,000 a year, decent for 2006.
Sarah got hired as a third-grade teacher at an elementary school in Aurora. She made $41,000. Combined, we were bringing in about $89,000 before taxes.
By Colorado standards, that put us solidly in the middle class.
Not rich, but stable, comfortable. We did everything the right way. We rented an apartment for 3 years while we saved money.
We drove used cars.
We packed our lunches.
We put aside money every month, first for an emergency fund, then for a down payment on a house.
By 2009, we'd saved $35,000. We bought a small 3-bedroom house in Thornton for $210,000. It wasn't fancy, but it had a yard and good schools nearby. It was ours.
Our son Tyler was born in 2010.
Healthy, perfect. Sarah took 12 weeks of unpaid maternity leave. We'd saved for it and went back to teaching in the fall.
Our daughter, Megan, came along in 2012.
2 kids, a house, 2 steady jobs.
We weren't living lavishly, but we were making it work.
We had a budget.
We stuck to it. We were building a life. Health insurance came through my employer.
United Healthcare, PPO plan.
It looked solid on paper, better than a lot of plans, actually. We paid $320 a month in premiums for family coverage.
That's about $3,840 a year.
The plan had a $3,000 annual deductible.
After that, we'd pay 20% co-insurance on covered services until we hit our out-of-pocket maximum of $8,000 per year.
Then, supposedly, insurance would cover everything at 100%.
The benefits booklet was 87 pages long. I never read it all.
I trusted that if we paid our premiums and stayed in network, we'd be protected.
We used the insurance the normal amount. Yearly checkups. Tyler broke his arm when he was 5. That cost us $1,200 after insurance.
Sarah had her gallbladder removed in 2014. We hit our deductible that year and paid about $4,500 total. It was a lot of money, but we managed.
We put it on a credit card, paid it off over 6 months, moved on. That's what insurance was supposed to do: make healthcare expensive but survivable.
Everything changed in March 2016.
Sarah was 34 years old.
She'd been feeling tired for a few months, which we chalked up to teaching full-time and raising 2 young kids. Then she noticed a lump in her right breast while showering.
She's not someone who panics, but she's also not someone who ignores things. She scheduled an appointment with her primary care doctor the next week.
The doctor felt the lump and ordered a mammogram. The mammogram led to an ultrasound. The ultrasound led to a biopsy.
We waited 2 weeks for the results. I remember sitting in the oncologist's office on a Tuesday afternoon.
The doctor was kind but direct. Stage 2B invasive ductal carcinoma, breast cancer.
Aggressive.
It had spread to 2 lymph nodes.
Sarah needed surgery, chemotherapy, and possibly radiation.
The doctor said her prognosis was good if we acted quickly, about 75% 5-year survival rate. I heard 25 chance my wife dies and felt my stomach drop.
We were scared, but we also felt like we'd be okay. We had insurance. Sarah worked for a school district with good benefits. I worked for a company that prided itself on taking care of employees. We had savings about $18,000 in our emergency fund. We owned our home. We thought we could handle this.
The oncologist referred us to a surgeon.
The surgeon recommended a partial mastectomy followed by 6 rounds of chemotherapy and 5 weeks of radiation.
It was an aggressive treatment plan, but the cancer was aggressive.
We scheduled the surgery for early April, 3 weeks away. That's when the bill started.
The first bill came before Sarah even had surgery.
It was from the hospital, a PI procedure deposit of $4,200.
The hospital billing department explained that insurance would reimburse us later, but they required payment upfront.
We put it on a credit card.
Then came bills for the PI surgery appointments, the anesthesia consultation, the surgical planning.
Each one was a few $100 here, $1,000 there.
Our deductible disappeared into weeks.
The surgery happened on April 12, 2016.
It went well.
The surgeon removed the tumor and 2 lymph nodes. Pathology showed clean margins. They'd gotten all the visible cancer. Sarah came home the next day, exhausted and in pain but hopeful.
The hospital bill arrived 3 weeks later.
$60,000 for the surgery.
Insurance covered it, but we owed our 20% co-insurance. Our portion, $12,400. I called United Healthcare to confirm this was right. They said yes, we'd met our deductible. So now we were in the co-insurance phase.
We'd pay 20% of all covered expenses until we hit our $8,000 out-of-pocket max. Then insurance would pay 100%.
I didn't understand how our portion could be more than the out-of-pocket maximum, but the representative explained.
Certain things didn't count toward the max. Facility fees, out-of-network charges even if we didn't choose them. Services deemed not medically necessary. I asked for clarification.
She said it was all in the policy document. I pulled up the 87-page booklet and tried to read it.
It was written in legal language I couldn't parse. I gave up and paid the bill.
Chemotherapy started in May.
Sarah's oncologist prescribed a drug combination that had proven effective.
6 cycles, 3 weeks apart.
Each treatment took about 4 hours. Sarah would sit in a recliner while toxic chemicals dripped into her veins through a port in her chest.
I took days of work to drive her and sit with her. My MOM watched the kids.
The first chemo treatment made Sarah violently ill.
She vomited for 3 days straight.
She couldn't eat, couldn't sleep, couldn't get out of bed.
The oncologist prescribed anti-nausea medication.
It helped a little, but not much. Sarah lost 15 pounds into weeks.
Her hair started falling out.
Tyler, who was 6, asked why Mommy looked sick. We told him she was getting medicine to make her better.
The bill for the first chemo treatment came 3 weeks later, $28,000.
Our insurance covered it, but we owed 20%.
Our portion, $5,600. I called United Healthcare again. I'd been tracking our expenses. We should have hit the $8,000 out-of-pocket max by now.
The representative put me on hold for 20 minutes, then came back and explained that some of the chemo drugs weren't on their preferred formulary. Those drugs didn't count toward our out-of-pocket maximum. Neither did the anti-nausea medications, which were billed separately. Neither did the lab work and monitoring appointments, which were billed under a different claim type.
I asked what did count toward the maximum. She said covered in-network services. I asked how I was supposed to know what that meant. She said I should have reviewed my policy before seeking treatment. I pointed out that my wife had cancer and needed treatment immediately. She said she understood, but that didn't change the policy terms.
We paid the bill. We had to. Sarah needed 5 more chemo treatments.
We couldn't stop now.
By July, we'd drained our emergency fund. We'd maxed out 2 credit cards.
We'd borrowed $10,000 from my parents.
And the bills kept coming. Every treatment generated 5 or 6 separate bills, one from the oncologist, one from the infusion center, one from the lab, one from the pharmacy, one from anesthesiology for the port placement, one from radiology for the monitoring scans. Each bill had different due dates, different payment addresses, different customer service numbers. I spent hours every week on the phone with billing departments and insurance.
I'd call United Healthcare and they'd say a claim was covered.
I'd call the hospital and they'd say insurance denied it.
I'd call United Healthcare back and they'd say it was processed correctly and we owed the balance.
I'd ask to speak to a supervisor.
I'd be transferred 3 times and eventually disconnected.
The bills were deliberately confusing. Line items listed codes like CPT 96413 and HCPCS J900 with no explanation of what they meant. The amounts billed, the amounts insurance paid, and the amounts we owed never seemed to add up correctly.
I'd find the same service billed twice or charges for things that never happened. When I'd call to dispute them, I'd be told I needed to submit a written appeal within 30 days of the original bill date. But I was calling about a bill from 2 months ago that I had just received.
Sarah finished chemotherapy in September. 6 cycles, each one harder than the last. She lost 30 pounds.
Her immune system was destroyed. She caught every cold the kids brought home from school. She developed neuropathy in her hands and feet, a side effect of the chemo drugs.
The oncologist said it might be permanent. Sarah had to take a leave of absence from teaching,
Unpaid, because she'd used all her sick days. Then came radiation.
5 days a week for 5 weeks. Shorter appointments than chemo, but still exhausting.
The radiation burned Sarah's skin.
She developed painful sores. She could barely lift her right arm.
But she kept going because the doctors said this was what would keep the cancer from coming back. Radiation bills were different from chemo bills.
Each session was billed separately.
25 sessions at about $2,800 each.
Insurance covered 80%, but we owed 20% of each one.
Our portion, $14,000.
I called United Healthcare.
I'd been tracking our spending.
We'd paid over $40,000 out of pocket at this point. How had we not hit our maximum?
The representative said radiation was billed under a different benefit category.
Different maximum.
I asked how many maximums there were. She said it depended on the type of service. I felt like I was losing my mind.
We had insurance.
We paid premiums for 10 years without using it much. Now that we needed it, it covered almost nothing. Every bill had a different explanation for why we owed money.
Out of network. Not covered, above usual and customary charges. Not medically necessary. We were being nickel and dimmed into bankruptcy by a system designed to confuse and exhaust us.
By November 2016, Sarah had finished active treatment.
The scans showed no evidence of disease. The oncologist was optimistic. Sarah was alive. We were grateful.
We were also $87,000 in debt.
That's how much we'd paid out of pocket in 8 months.
Our savings were gone. Our credit cards were maxed out.
We'd taken out a personal loan at 18% interest.
We'd borrowed from my parents, Sarah's parents, and my brother.
We'd stopped contributing to retirement. We'd stopped taking the kids anywhere that cost money. And the bills were still coming.
Follow-up appointments every 3 months. Scans every 6 months. Ongoing medication. Physical therapy for the lymphedema Sarah developed after her lymph nodes were removed.
Each one generated more bills, more denials, more collections notices. In January 2017, Sarah went back to work. She'd been out for 6 months, all unpaid. We needed the income desperately, but she was still weak, still in pain, still dealing with side effects.
She'd come home exhausted and cry because she couldn't give her students the energy they deserve.
I was working 50-hour weeks trying to make up for lost time. My boss had been understanding during Sarah's treatment, but now he expected me to be fully present. I was never fully present.
I was constantly stressed about money, constantly on the phone with billing departments, constantly checking the mail for new bills.
In March 2017, we missed our first mortgage payment. We'd been prioritizing medical bills because collection agencies were calling constantly.
The hospital had sent several bills to collections. We were getting threatening letters about lawsuits and wage garnishment.
We couldn't let that happen. We needed our paychecks. We missed the second mortgage payment in April.
The bank called. I explained the situation. They said they understood, but we needed to get current or they'd start foreclosure proceedings. I asked about payment plans or forbearance. They said we didn't qualify because we were already in default. In May, we got a foreclosure notice.
We had 90 days to pay the missed payments plus late fees and legal costs about $800 or we'd lose the house. We didn't have $8,000. We didn't have $800. Every dollar we made went to keeping the lights on and the kids fed and the credit card companies from suing us.
I called a bankruptcy attorney. I never thought I'd be that person, but I didn't know what else to do. The attorney reviewed our finances. He said we qualified for Chapter 7 bankruptcy. It would wipe out the medical debt, the credit card debt, and the personal loan.
We'd still lose the house. Bankruptcy doesn't stop foreclosure if you're too far behind, but at least we wouldn't owe the difference if the house sold for less than we owed. The attorney's fee was $2,500. We didn't have it.
He said most clients paid in installments. We set up a payment plan 500 upfront, $500 a month for 4 months.
We borrowed the first payment from my parents. Again,
we filed for bankruptcy in August 2017, 17 months after Sarah's diagnosis.
The medical debt alone was $112. Oh, that's what we actually owed after insurance paid their portion. Credit card debt from medical expenses was another $34,000. Personal loan was $15,000. Total, $161,000.
On top of that, we were $12,000 behind on our mortgage. Our house was worth less than we owed on it.
The bankruptcy process was humiliating. We had to submit every financial document we had: pay stubs, tax returns, bank statements, credit card statements. We had to list every asset we owned: our cars, our furniture, Sarah's wedding ring. We had to attend a hearing where a trustee asked us questions like, why did you take your kids to McDonald's last month? And why do you have Netflix?
As if a $9 streaming service was the reason we were $161,000 in debt.
The bankruptcy was finalized in November 2017. The medical debt was discharged. The credit card debt was gone.
We felt relief for about a day. Then reality set in. We'd lost our house. The bank foreclosed in December.
We had 30 days to move out.
We couldn't afford to rent a house. Our credit was destroyed. And landlords wanted 3 times the rent as monthly income. We couldn't qualify for that anymore with bankruptcy on our record. We moved into a 2-bedroom apartment in a rough neighborhood.
The rent was $1,100 a month, cheaper than our mortgage had been, but it was cramped and loud.
Tyler and Megan shared a bedroom. They cried about leaving their friends in their rooms and their backyard.
Sarah's cancer has been in remission for 8 years now. She's alive. That's what matters most.
But we're still dealing with the consequences of her diagnosis. Our credit score is in the low 500 seconds. We can't buy a house. We can't finance a decent car. We drive a 2003 Honda with 180,000 miles that breaks down constantly.
We have no retirement savings. We're both 42 years old with $0 saved. We won't be able to retire, probably ever. The bankruptcy stays on our credit report for 10 years.
It'll fall off in 2027.
By then, we'll be in our 50s. We lost our entire 30s, the decade when you're supposed to build wealth. Here's what makes me angry. We had insurance. We paid premiums for 10 years, about $40,000 total.
When we finally needed it, it failed us.
Not because we made bad choices. Not because we went out of network or got unnecessary care.
But because the insurance industry writes policies designed to deny coverage.
They use confusing language, arbitrary categories, and bureaucratic mazes to avoid paying claims. They profit by taking our money,
then finding reasons not to give it back when we need it. I learned that health insurance companies are incentivized to deny claims. They have entire departments dedicated to finding reasons not to pay. They know most people won't fight back because they're too sick, too exhausted, or too confused by the system.
They count on us giving up.
I learned that out-of-pocket maximum doesn't mean what it sounds like.
It doesn't include out-of-network charges, even if you had no choice about the provider.
It doesn't include drugs not on their formulary. It doesn't include services they deem not medically necessary, even if your doctor says they are.
The real maximum is whatever they decide it is.
I learned that hospitals charge insane amounts because they know insurance will negotiate down. But if insurance denies the claim, you're stuck with the full inflated price.
A bag of saline that costs $1 to make gets billed at $500. A 15-minute doctor visit gets billed at $800. The prices are made up, and patients have no power to negotiate.
I learned that medical debt is the #1 cause of bankruptcy in America.
Over 60% of bankruptcies involve medical debt. Most of those people had insurance.
Having insurance in America doesn't protect you, it just determines how slowly you go bankrupt.
Sarah and I are still married. A lot of couples don't survive this kind of financial trauma.
We fought constantly in 2017 and 2018.
We blamed each other for things that weren't anyone's fault. The stress of poverty is relentless, it seeps into everything. But we made it through. Barely.
Tyler is 14 now. Megan is 12. They don't remember living in the house.
They think apartments are normal.
They don't know that we used to have savings and plans and hope. They just know that money is always tight and Mom and Dad are always stressed.
I think about the insurance company executives who made millions while we lost everything. United Healthcare's CEO made $20 million in 2016, the same year they denied claim after claim for my wife's cancer treatment.
Their company made $7 billion in profit.
They could have covered Sarah's treatment completely, and it wouldn't have even registered in their annual report.
But they didn't, because profit matters more than patience.
I think about the hospital administrators who charge $28,000 for a single chemotherapy treatment,
Who bill separately for every tiny component to maximize revenue.
who send threatening collection letters to cancer patients,
Who put liens on people's homes over medical bills. They're not doctors trying to help people, their businesses extracting maximum profit from human suffering.
I think about the pharmaceutical companies that charge $8,000 for anti-nausea medication,
That patent their drugs to prevent generic competition.
that spend more on marketing than research.
That lobby Congress to prevent Medicare from negotiating drug prices. They're not saving lives, they're profiting from illness. The American healthcare system isn't broken. It's working exactly as designed. It's designed to generate profit for insurance companies, hospital corporations, and pharmaceutical manufacturers. Patients are just the raw material they extract value from.
Our suffering is their business model.
Sometimes people ask if I blame myself, if we should have had better insurance, or more savings, or been more prepared.
The answer is no. We had good insurance, better than most Americans. We had savings more than 60% of Americans who can't cover a $1,000 emergency. We did everything right.
The system failed us anyway.
This is what medical bankruptcy looks like.
It doesn't happen to irresponsible people.
It happens to middle-class families with jobs and insurance and savings. It happens to people who did everything they were supposed to do.
It happens because American healthcare is designed to profit from our illness and destroy us financially if we get sick.
Sarah is alive.
I remind myself of that every day.
We didn't lose her. We lost our house, our savings, our credit, our security, our future, but we didn't lose her. And that has to be enough.
But it shouldn't have to be a choice between saving someone's life and destroying the family financially. In every other developed country, it's not a choice. Only in America do we force families to choose between life and bankruptcy. If this story resonates with you, I'm sorry.
That means you've probably experienced this system yourself.
Hit the like button and drop a comment. Subscribe for more real stories about what life in America actually looks like.
And if you're dealing with medical debt right now, know that you're not alone.
Over 100 million Americans have medical debt.
It's not your fault.
The system is designed to fail us. Now I work 2 jobs.
Sarah still teaches.
We save nothing, we're still digging out of debt.
We'll probably never own a home again.
We'll never retire. We'll work until we die.
Because my wife got cancer in America.
If this story resonated with you, hit the like button and drop a comment below. Subscribe for more real stories about what life in America actually looks like.
And if you're dealing with medical debt right now, know that you're not alone.
Over 100 million Americans have medical debt. The system is designed to fail us.
Thank you for watching.